This module shows you how to fit more complex natural ectasias using lens designs outside the range of the diagnostic set. Post-surgical fittings are described in the next module in this section. Identifying the corneal shape from clinical measurements and topography is important when fitting these cases, as well as a sound grasp of the fitting methods described so far. You must complete the core fitting modules before you work through this section. When fitting advanced natural ectasias, standard periphery lenses should be tried in the first instance, as they often provide an optimum fit. However, if they do not, the KeraSoft IC lens can be modified by ordering standard periphery lenses outside the range of the diagnostic set, by modifying the whole periphery of the lens, by modifying a section of the periphery using what is called sector management control. First, let us look at when it is appropriate to order standard periphery diagnostic lenses outside the range of the diagnostic set. If the advanced central ectasia has a steep periphery, all lenses in the diagnostic set may be too flat and even lift off or flute at the edge. For these cases, standard periphery diagnostic lenses with base curves of 7.6 or 7.4 can be ordered for fitting trials. For corneas demonstrating significant areas of flattening, even the flattest lenses in the set may show air bubbles or tight fitting characteristics. Here, standard periphery diagnostic lenses of base curves 9 to 9.4 can be ordered. Now let us look at modifying the whole periphery of the lens. The most common use of full peripheral change is keratoconus, where the peripheral cornea is very flat. Standard periphery lenses will have difficulty settling on this type of cornea, which results in tears pulling under the lens. This causes poor, fluctuating visual acuity that will not improve with over-refraction. To assist in fitting this type of cornea, an H2 flat 2 lens is provided in the diagnostic set. In most cases, this lens configuration enables an alignment fit. However, if the central ectasia is particularly steep, and even this diagnostic lens fails to settle, order a flat 2 periphery lens with a steeper base curve, for example, 7.8 flat 2. A lens with a modified periphery is assessed in the same way as a standard periphery lens, and the Morocco VA guidelines still apply. Let us now look at sector management control, SMC. Some corneas with natural ectasias demonstrate areas that are significantly flat and steep, often along the same meridian. This shape is often difficult to fit with a rotationally symmetrical lens. Using sector management control, up to 2 sectors of the periphery can be modified independently, the location of which is decided by the practitioner. The peripheries in these sectors can be flattened, steepened, or left as standard. SMC lenses are assessed on eye in the same way as standard periphery lenses, and the Morocco guidelines still apply. In a moment, we will look at specific clinical scenarios where sector management control is used. But first, let us look at the principles of the lens design. The modified sectors can be at any position around the circumference of the lens. However, the only requirement is that there must be at least 30 degrees between the sectors to allow blending from one zone to the next. For the majority of cases, a classic SMC design is used. This design utilises superior and inferior sectors. A1 represents the starting point of the superior sector and is at 30 degrees on the lens periphery. A2 is its end point at 150 degrees. The inferior sector lies between A3 at 220 degrees and A4 at 320 degrees. In between the inferior and superior sector, the periphery is blended. Sector management control is typically used where all standard periphery lenses drop, regardless of the base curve tried, due to the curvature of the cornea, for example with pellucid marginal degeneration. No diagnostic lens can be found that gives consistent visual acuity and an optimal fit. Or the optimal fitting standard periphery lens consistently provides ghosting or shadowing of images. Let us look at the first scenario. If a lens rides low or drops significantly on upward gaze, regardless of the standard periphery lens used, this may indicate that the inferior cornea is steep and is not providing enough support for the lens in this area, in which case, Steepen the inferior sector by 1 step to centre the lens using the classic SMC design.
Even this small change can significantly affect the fit. In the second scenario, the best fitting standard periphery lens consistently provides poor visual acuity. The patient may also report discomfort at the top edge, indicating it is tight in this area. A flatter lens may improve the visual acuity and comfort, but now the lens may demonstrate unstable rotation or even slight fluting inferiorly. This indicates a cornea that is significantly flatter in the superior area compared to the inferior.
Tightening the lens in the inferior sector only will resolve these fitting issues.
First, identify the standard lens which gives the best visual acuity. This will determine the final base curve. Then, find the lens that gives the optimal fit, following Morocco guidelines. The difference between the base curves of these lenses determines how much to steepen the inferior sector. Use the KeraSoft IC periphery table to determine the amount of change required, as outlined in the periphery module in the core fitting section.
In the third scenario, where there is significant inferior corneal curvature, the optimal standard periphery diagnostic lens still results in visual acuity that displays marked ghosting and shadowing. This is a result of tears pooling in the inferior sector. Tightening the lens only in the inferior sector by 1 step will often resolve this issue, as it ensures a more uniform tear layer under the lens.
To order this lens, the prescription should be written so that the sector defined by A1 and A2 is written first, and the sector between A3 and A4 second. Here is an example of how this is written. 8.6, 14.5, standard, A1 30, A2 150, steep 1, A3 220, A4 320. If a customised SMC design is required, a trial SMC diagnostic lens can be designed with our lab customer services. They will take into account the topography, information about the corneal shape, and details of the best performing standard diagnostic lens to design an appropriate diagnostic lens.